Genital herpes is one of the most common sexually transmitted infections worldwide, affecting millions of women. It is a viral infection caused by the herpes simplex virus. A diagnosis of genital herpes can feel overwhelming, but it's important to understand that it is a manageable condition. While there is no cure for the virus, there are highly effective ways to manage symptoms, reduce outbreaks, and prevent transmission to partners. Gaining a clear understanding of genital herpes is the first and most powerful step toward living a full, healthy, and confident life with the virus. This is not a reflection of your character or worth. It is simply a very common skin condition. The viruses behind genital herpes. Genital herpes is caused by two types of the herpes simplex virus, known as HSV. Herpes simplex virus type 1, or HSV1, is the virus that most people associate with cold sores or fever blisters around the mouth. It is incredibly common, and many people are exposed to it during childhood through non-sexual contact, like a kiss from a relative. However, HSV1 can also be transmitted to the genital area through oral genital sex. Genital infections caused by HSV1 have become increasingly common, especially among young women. Herpes simplex virus type 2, or HSV2, is the virus most commonly associated with genital herpes. It is almost exclusively transmitted through sexual contact, including vaginal, anal, and skin-to-skin contact with the genital area of someone who has the virus. While the two types are distinct, their effect on the genital area is very similar. One key difference is that genital herpes caused by HSV1 tends to cause fewer recurrent outbreaks than genital herpes caused by HSV2. Knowing which type you have can sometimes help predict the future course of the infection, but the management and prevention strategies are largely the same. How herpes is transmitted and how it works. The herpes simplex virus is spread through direct contact with an infected area. This means you can get genital herpes through contact with a herpes sore, the saliva of a partner with an oral herpes infection, or the genital fluids of a partner with a genital herpes infection. A crucial point to understand is that the virus can also be transmitted even when there are no visible sores or symptoms. This is called asymptomatic shedding, and it is when the virus is active on the skin's surface without causing any noticeable signs. This is a primary reason why the virus is so widespread. Once the virus enters your body, it travels to the nerve roots near your spinal cord and remains there for life in a dormant state. For many people, the virus stays inactive and never causes any problems. For others, the virus can periodically travel back up the nerve pathways to the surface of the skin, causing an outbreak of sores. These outbreaks are often triggered by certain factors that can vary from person to person. Common triggers include stress, illness, fatigue, menstruation, and friction or irritation in the genital area. The clinical journey, primary outbreak, and recurrences. The experience of genital herpes can vary greatly from one woman to another. Many women who carry the virus may never have a noticeable outbreak. A primary outbreak is the first time you experience symptoms after being infected. If it occurs, it usually happens within 2 to 12 days of exposure. A primary outbreak is often the most severe. Symptoms can be significant and may include a flu-like illness with fever, body aches, and swollen lymph nodes in the groin. You may experience tingling, itching, or burning in the genital or buttock area. This is followed by the appearance of one or more small, painful blisters. These blisters will eventually break, leaving tender ulcers that can take 2 to 4 weeks to heal completely. For women, these sores can appear on the vulva, inside the vagina, on the cervix, or around the anus, making urination painful. Recurrent outbreaks are subsequent episodes of symptoms. These are usually much shorter and less severe than the primary outbreak. The flu-like symptoms are typically absent, and the sores are fewer, heal more quickly, often within a week, and are less painful. Many women experience a warning sign called a prodrome before a recurrence. This can include tingling, itching, or pain in the area where the sores will appear, which can be a helpful signal to start treatment and take precautions to avoid transmission. Over time, these recurrent outbreaks usually become less frequent and less intense. Recognizing the symptoms in women. The symptoms of genital herpes can be classic and obvious, but they can also be very subtle and easily mistaken for other conditions. This is why many women do not know they have it. Classic symptoms include one or more painful blisters or ulcers in the genital area, on the buttocks, or on the inner thighs. These can be accompanied by itching, burning, and pain. However, atypical symptoms are very common. A woman might experience small cuts, cracks, or fissures in the skin, general redness and inflammation without obvious sores, a persistent itchy spot, pain that feels like a pulled muscle in the buttocks or legs, which is actually nerve pain from the virus, an unusual vaginal discharge, a burning sensation during urination, which can be misdiagnosed as a urinary tract infection or a yeast infection. Because the symptoms can be so varied and mimic other conditions, self-diagnosis is unreliable. The only way to know for sure if you have herpes is to see a healthcare provider and get tested. Getting professional help, diagnosis, and testing. If you suspect you have genital herpes, it is important to see a healthcare provider as soon as possible, especially if you have active sores. You can consult with your gynecologist, a general family doctor, or visit a specialized sexual health clinic. There are two main ways to diagnose genital herpes. 1. A swab test. This is the most accurate method if you have a visible sore, blister, or ulcer. Your doctor will use a soft swab to collect a fluid sample directly from the sore. This sample is then sent to a lab for a viral culture or a test called a PCR test, which stands for polymerase chain reaction. The PCR test is more sensitive and is now the preferred method as it detects the virus's genetic material. This test can also determine the type of virus, whether it is HSV1 or HSV2. 2. A blood test. A blood test can be used when you do not have active symptoms. It detects antibodies to the herpes virus, which are proteins your immune system creates to fight the infection. These tests, called type-specific IgG antibody tests, are important because they can tell you if you have HSV1 or HSV2 and can confirm a herpes infection, even if you have never had a recognizable outbreak. It is important to wait about 12 weeks after a potential exposure before having a blood test, as it takes time for the body to develop detectable antibody. While there is no cure for herpes, there are excellent antiviral medications that can manage the infection very effectively. These medications work by preventing the herpes virus from multiplying. The main antiviral drugs used are acyclovir, valacyclovir, and famciclovir. There are two primary ways these medications are used: episodic therapy. This involves taking the medication for a short period, typically 1 to 5 days, as soon as you notice the warning signs of an outbreak or the appearance of sores. This can significantly shorten the duration of the outbreak and reduce the severity of the symptoms. Suppressive therapy. This involves taking a lower dose of an antiviral medication every single day. Daily suppressive therapy is highly effective and can reduce the number of outbreaks you have by 70 to 80%. For many women, it stops outbreaks altogether. A major benefit of suppressive therapy is that it also dramatically reduces the risk of asymptomatic shedding, which in turn reduces the risk of transmitting the virus to a partner by about 50%. Deciding between episodic and suppressive therapy is a personal choice you can make with your doctor based on the frequency and severity of your outbreaks and your desire to reduce transmission risk. To alleviate discomfort during an outbreak, you can try taking over-the-counter pain relievers, applying cool compresses to the sores, wearing loose-fitting cotton underwear, and pouring water over the area while you urinate to reduce stinging. Rehabilitation. Living well with herpes. Living with herpes involves both physical and emotional care. The concept of rehabilitation is about learning to manage the virus so it has a minimal impact on your life and well-being. Physically, this means understanding your personal outbreak triggers. Keeping a simple journal can help you identify if things like stress, lack of sleep, or certain foods are linked to your recurrences. Emotionally, a herpes diagnosis can be distressing. It is important to process these feelings and not let the virus define you. Seeking support is key. This can come from a trusted friend, a partner, or a therapist. There are also many excellent online support groups where you can connect with other women who are navigating life with herpes. Educating yourself with reliable information is one of the best ways to combat stigma and fear. Understanding the facts helps you put the virus in its proper perspective as a common, manageable skin condition. Communicating with a sexual partner is a crucial part of managing herpes. This can be a scary conversation, but it is an act of honesty and respect. A good time to talk is before you become sexually intimate. You can explain what genital herpes is, how you manage it, and the steps you can both take to reduce the risk of transmission. such as using condoms and suppressive therapy. Preventing the spread of herpes is a shared responsibility. If you have genital herpes, the most effective ways to protect your partner are: avoid sex during an outbreak. Do not have vaginal, anal, or oral sex from the first sign of prodrome until your sores have completely healed. Use condoms. Latex condoms, when used consistently and correctly, can reduce the risk of transmission, but they are not 100% effective because the virus can be present on skin that is not covered by the condom. Consider suppressive therapy. Daily antiviral medication can significantly reduce your risk of passing the virus to a partner. Combining these strategies provides the greatest level of protection. Research and expert perspectives. The scientific community is actively researching herpes with two main goals: developing better treatments and creating a vaccine. A preventative vaccine that could stop people from getting infected in the first place, as well as a therapeutic vaccine that could help treat people who already have the virus, are both under investigation. Leading experts in the field work to destigmatize the virus and provide accurate information. Terry Warren, a nurse practitioner and a nationally recognized expert who has run herpes research clinics for decades, is a prominent voice. In her book The Good News About the Bad News, she works to dispel fear with facts, stating, "Herpes is a minor skin condition caused by a very common virus. It does not cause cancer, it does not cause sterility, and it does not kill you. It just gives you blisters or sores from time to time." This perspective is crucial for reframing the diagnosis. Dr. Anna Wald, a leading researcher at the University of Washington, has published hundreds of papers on herpes simplex virus. Her research has been instrumental in understanding asymptomatic shedding and the effectiveness of suppressive therapy. A consistent theme in her work is the importance of accurate type-specific testing. She has noted that a diagnosis of genital herpes can have a significant psychological impact, often far greater than its physical impact, highlighting the need for patient education and counseling. In authoritative medical resources like Mandel, Douglas, and Bennett's Principles and Practice of Infectious Diseases, the focus is on the clinical management of the virus. The text details the efficacy of antiviral medications and underscores the importance of counseling patients about the natural history of the disease, sexual transmission, and methods to reduce it. The collective expert consensus is clear: while a herpes diagnosis is life-changing, it does not have to be life-ruining. With accurate information, effective treatments, and a supportive mindset, women can manage the virus and continue to have healthy relationships and lives.